Cured lepers in the country are barely thriving at the various leprosaria where they reside. They mostly depend on food stamps and donations by benevolent persons. In an exclusive interview with GBC News, the director of the Weija Leprosarium, Father Andrew Campbell, disclosed that the cured lepers are each allocated 2 cedis for their daily upkeep by government. Certainly not enough to buy a ball of kinky sold at 5 cedis without fish and perhaps pepper, which is also purportedly sold to the public. What's more, these cured lepers are also stigmatized against by society, for which reason no social worker posted to the facility showed up for their national service this year. Here's a report by Sarah Ofori.
At the Weija Leprosarium reside a couple, both of whom are cured of their leprosy. 94-year-old Mr. Kojo Aggrey and his wife Madam Rose Mantey, 77, have both their fingers and toes affected by the disease. They first met at the Ankaful Leprosarium as inmates in the 1960s and later got married and started a family in 1978. They had 2 children. Their 50-year-old daughter lives with them to assist them at the leprosarium, yet does not have leprosy.
The Ankaful Leprosarium, 64 to 69, 5 years. No discharge me now. I'm back graphic times agent. Now I supply me papers. My boys are me supply on. At the same time, me a lotto agent, me kiosk, and so nipa team sa. Na 1990, na many started say hame wakra.
As he continued his narrative about life before and after being cured of leprosy, he disclosed that he was finally admitted at the Weija Leprosarium in 2005 by Reverend Father Andrew Campbell, who also provides them with their daily and healthcare needs. He tells me they used to receive stipends from government's Livelihood Empowerment Against Poverty fund to support poor households.
Leave 1 buy, 2 months of grain, 1 buy. One wash here, then we donors, no coffee or boy and kakran.
There are 5 leprosaria in the country, catering for over 1,500 inmates, 1 at Nkanchina, Wa, Ankaful, Ho, and the Weija Leprosarium.
Here at Weija, we take care of all the other stations. Every twice a year, the called a common fund. They give us money to buy food for all those in Ho, Nkanchina, Kokofu, Wa, and Ankaful and Weija. They give us money, and we go there and spend a few days and bring them food because they are really in need of there. Not all of them are on the LEPER fund. All those here are on the LEPER fund. They get 2 cedis a day, which is inadequate, 2 cedis. But some of the other settlements, not all of them receive 2 cedis a day. I mean, who can live on 2 cedis a day? Yesterday I ate a ball of kenke and it was about 5 cedis. So how can you live on 2 cedis a day? It's a big challenge. And we wish they would increase it to help them to be able to live. Because when they don't have money, I have to beg for it.
Over 200 cases of leprosy are recorded annually, yet, with the exception of 1, all other cases are said to be cured and residing in the various leprosaria across the country. Father Campbell, however, expressed his disappointment about the fact that cured lepers continue to be stigmatized against.
The stigma. People are still afraid to come near these people. All these people here today, despite their disabilities, they're all cured. But they're not accepted by their families. They're not accepted by their homes. They're not accepted. When people hear the leprosarium, immediately they get frightened. We always apply to a national service for personnel to work here. This year, we couldn't get anybody. As soon as they found out they were being assigned to Weija, they didn't turn up. They're afraid. Why? Why? The only people who come here are people, nurses, and who come from private nursing schools. But from the government schools, nobody comes. I'm 50 years working with them, and look at me. Look at me, I'm not infected.
He shared the stories of some of the inmates, describing them as horrendous.
We've got one girl aged 4. She came here when she was 2 years of age. She came from the north, from Wa. She was in hospital there, and she had leprosy. How she got it, nobody knows. When they found out she had leprosy, the mother ran away. The grandfather said she's not human, so he wanted to kill her. We took her here, and she's gone through a lot. The leprosy affected her. She was walking on hot coals, and it affected a bone in her leg and on the eyes. One woman told me a story. When she was young and she had leprosy, they put her in a shed in the back garden, a shed, and bring her food and give it to her and run away. And one day she woke up and there was a big black cobra, just walking right over her. Yeah. So she packed bags and came here, and we took her. We've one old man now, well, he's only 72, and he went blind in his hometown up in Sanyani. The family would put food outside his door one day, next day they wouldn't put any food outside it. They put water outside the door one day, another day they wouldn't put water. So he was being badly treated. So he heard of me and he's decided to come here. 6 o'clock one morning he arrives at my house. He said, I want to stay with you. I said, you're most welcome. So we kept him. And now he's fine now. He's still blind, but he's fine. He's happy here. After about a month here, he said, Father, now I feel human.
The Weija Leprosarium has 4 dedicated nurses attending to the inmates. DORCAS TWUMASI is one of the nurses who's never looked back since she was assigned to the Leprosarium from the Malam Demonstration Clinic in Accra.
I really love to help the needy and those dejected and all that. So when I came, I was so happy to be with them, because most of them have lots of stories to tell you, and then you feel so happy to be around them. We were also told that they are cured lepers, and then they go for treatments for a whole year, and then they come back here. That's for those whose families have rejected them.
Even though leprosy medications are free, the Leprosarium sometimes have to pay for some services at the hospital.
We cook for those who cannot cook. We cook for them. We give them 2 good meals every day. We give them. When they are sick, we give them the best medical treatment. We bring them to the best doctors, and we go to Ridge. And we pay for their operations, we pay for their medical care.
The Ghana Dental Association on World Oral Day reached out to the cured lepers to give them dental care, something Father Campbell describes as very rare.
Because these are people, whose condition is associated with a lot of stigma. So we wanted to raise awareness and also conscientize people to know that they are also human beings. Then secondly, this particular disease that they suffer from affects their motor skill. That is the use of their hands freely. And if you are not able to use your hands freely, it means that you can't even hold a toothbrush to do the regular cleaning, how much more 2 times a day.
Father Campbell is admonishing government to give special care to all persons with disabilities without any discrimination, especially in geriatric care.
The average age now is going up and up because of the medical care. The medical care, people are living to 70, 80 years of age. We haven't made provision for that. They should pass a bill to help them. Free transport, access to buildings. You see them going to buildings and there's no proper ramps and others for the handicapped and the aged, and others there's not. Free medicine, that's not available. Medicine's expensive, I know that because I pay for them here. So medicine, so they need to pass a bill to be able to give more assistance. So when an elderly person goes to hospital, he hasn't got to go a long queue and wait till 2 or 3 o'clock in the afternoon and before he sees the doctor. It should be special people, and they should train people in geriatrics and and taking care of the. They need to train them. They're not training enough. Not training. I don't know how many they train here. I don't know, but we need more doctors who are trained in looking after the aged. That's what we need.
Ofori, GBC News, Weija Leprosarium, Accra.